Welcome back to Indiana News Desk. I'm Joe Wren. If you have an elderly loved one who lives in a nursing home, it's a situation you've probably experienced. Your loved one gets sick and he's transported to a hospital for a few days for treatment and then brought back to the nursing home. Data shows in nearly half of these cases, the elderly person could be treated in the nursing home and wouldn't have to go to the hospital. As Sara Wittmeyer reports, these unnecessary hospitalizations cost billions of dollars each year and negatively impact patients' health.
As Terry McClinton makes her rounds at North Capitol Nursing Home, she's looking for any changes in people's conditions, even if it seems minor. Her mentality is if she can catch a problem early, she can work to treat it and keep a resident from being transferred to the hospital.
A lot of things that they do there in the hospital can be done here. I've had a case where a resident did have elevated labs, and we did sit down and we called the doctor, and we convinced him to just give a few days of IV fluid treatments, and she felt better in a few days.
If someone is acutely ill, then McClinton will call the person's doctor, and in those cases, the resident would likely be transferred to a hospital. This is a new approach. It's actually part of a pilot program called Optimistic to see if this type of proactive caregiving, looking for condition changes early, can make a difference in the number of unnecessary hospitalizations.
Optimistic, our intervention is designed to put these extra resources in nursing homes, see what kind of a difference that we can make in providing that enhanced care. Geriatric patients who are hospitalized are at risk for all kinds of bad things. Risk of falls, these are complicated patients, so lots of providers involved, risk of medication errors. When they come back to the facility, there's an almost certainty that they will have a reduced level of functioning, less strength, they haven't been walking around as much, and need rehabilitation services.
The Centers for Medicaid Service is partnering with 145 nursing facilities in 7 states to implement the trial program. 19 of those nursing homes are in Indiana. Each Indiana facility gets a registered nurse like McClinton, and there's a shared pool of nurse practitioners who visit the facilities and help fill in the gaps.
The 19 facilities that we have partnered with in this initiative were already working on reducing avoidable hospitalizations. And that's important because it's a big deal for them to accept an outside person coming in and jumping into their team and talking to them about how could we do things differently? Should we try this? Should we try, this new tool?
The push of the industry to decrease hospitalizations, we certainly wanted to be on the front end of innovation, frankly, on how we can get on board with that.
The Affordable Care Act mandates nursing homes develop plans to improve health care quality and reduce Medicare and Medicaid costs. And reducing avoidable hospitalizations absolutely figures into that. Figures from 2011 show unnecessary hospitalizations each year among Medicare and Medicaid patients cost between $7 and $8 billion. The reason these avoidable hospitalizations cost so much is complicated.
So the easiest way to visualize this is possibly to look at these umbrellas. So let's think of the pink umbrella as Medicaid. So we'll label this one Medicaid. And then we'll label the orange one Medicare. Most long-term nursing home residents fall under this Medicaid umbrella. But let's say they get transferred to the hospital. Then this Medicare benefit kicks in. And if they're in the hospital for 3 or more days and then they return home to the nursing home care facility, something called the Medicare post-acute benefit kicks in. And that reimburses at a much higher rate because the reasoning is that people who've been hospitalized probably require more care. They might require therapy, something like that. So a nursing home all of a sudden is getting reimbursed from this Medicare fund and this Medicaid pot. So if you've heard about nursing homes getting reimbursed twice or double dipping, that's what people are talking about.
A lot of the discussion about why transfers happen from the perspective of federal policymakers is that the financial incentives are misaligned and encourage facilities to send residents out, and that the federal government is going to change these incentives in some way to try to favor treating people in nursing homes.
Unroe says the big question is whether nursing homes have the resources to provide that extra care, even if they want to. That, of course, is what the pilot project does. If it's successful, Unroe says part of what the government might do when it restructures the financial incentives is look at adding additional resources in nursing homes on a permanent basis.
The grant for the project runs for 4 years. It's been about 1.5 years, and while everyone we talked to said it was too early to determine whether it was a success, Torrin Jackson says at her facility there's been a notable decline in unnecessary hospitalizations.